Well, let's just go across to the management of Niva Bupa now. So, general insurance industry growth slowed in October, with certain players performing strongly. We have Mr. Vishwanath, ED and CFO of Niva Bupa Health Insurance. Mr. Vishwanath, great to have you with us here. Good morning. I don't think we've spoken after your second quarter numbers, which is July to September. And of course, after that, you've also reported, October numbers. That is the monthly numbers as well, which have now come through. So, I mean, I guess we can go backwards, right? Look at the latest, which is what you've seen in October. So, 50% retail growth is what we pick up. You've managed to do in October. That's a monthly number, and the ticket size in October is some 15% higher. These are very strong numbers. Could you give us a sense of what happened in October?
Yeah, good morning and thanks for inviting me to the show. So let me just decode October numbers for you. So one thing which has happened is this GST, and it is a very, very positive impact. And as you know, we all decided, specifically I can talk about our company, to pass on the entire GST benefit to us. And the idea of this is that volume should increase, and that's what we are seeing. So so the reported numbers are slightly different. So 67% overall, 50 plus 56% retail. But if I just give you a like-to-like number, which is without 1/n, and that's what we have been, suggesting to look at. So in the quarter one, in fact, in the H1, if we see April to September, our retail growth like-to-like was 28%. The same number for October is 40%. So that's the kind of uptick we have seen. So 2-3 reasons. One, of course, is GST. There was already very good awareness of health insurance post-COVID, but this has also gave boost to affordability, the GST exemption. And second, we launched a product, Reassure 3.0, that has got very good reception. So this is a combination of 2-3 things. Of course, there's higher awareness, there's interest for this category, and that's now converting into actual sale.
Yeah.
And we have product.
Can I come in, sir?
So these are yeah.
Yeah. Sorry, you're saying that retail premium growth in H1 was 28%, right?
Yes.
And in October, that like-to-like number is up 40%.
40%. That's right. Yeah. And
the entire GST cut has been passed on to distributors.
That's right. Yeah. To customers. And the GST, this exemption is passed on to customers. What that means is we have not increased rates.
Yes, that's what I meant. Sorry. Yes, you've not. You've passed it on basically to end consumers.
Yeah, that's right. Yeah.
Okay. And this 1/n, which is basically accounting for premium over the term of the policy, these numbers are based on that method?
The one which I quoted you, that 40% retail growth are without that 1/n. Okay. With 1/n, it is higher because, this was implemented 1st October 2024. Now the premium which was deferred has started coming in, and which is true for the entire industry. And the numbers are there in front of you.
And why is the average ticket size gone up as well? So any particular reason?
Yeah, one is related to Reassure 3.2, the new product. Second is also because people are upgrading their sum insured. Those who are renewing, not only the persistency is high, but they are upgrading their sum insured. So upsell, cross-sell is also one factor. And of course, with the high affordability, people are going for high ticket size products.
Got that. There is also some talk that health and general insurance companies were in talks with hospitals to find some arrangement on rate increases by hospitals. Have you reached any such agreements? You can tell us.
Yeah, so that's one project which has been taken at General Insurance Council level, which is industry body. And they are looking at few things. One, of course, is standardization of tariff, common empanelment, standardization of protocol, admission criteria, etc. So that project is going on. It's slightly longer term.
Okay.
But what I understand, it's gaining traction.
Last question, sir. Fettletone, which is an investor, they have about 8, just under 8%, and we understand they're looking to sell about 5% of that. Anything you can tell us?
About Fettletone, it is a true north vehicle. Of
Yes.
course, being private equity, it has finite life. At some point in time, they will exit. I'm not sure about the timing. But one thing I can assure you is it's going to be a very coordinated sale. They are very, very responsible investors. So we don't have to worry about supply overhang if that's what you're alluding to.
All right. Thanks very much, sir. Thank you for joining us. Appreciate it. And we'll talk more